Engrossed House Bill 4334, clarifying the requirements for a license to practice as an advanced practice registered nurse and expanding prescriptive authority. The bill was advanced to third reading with the right to amend.
Questions on pass? Are there amendments?
Yes, sir. The Committee on Health and Human Resources.
The Senator from Ohio.
Thank you, Mr. President. I ask unanimous consent to explain the amendment in lieu of having it read.
Is there objection? Chair hears none. Senator from Ohio.
Thank you, Mr. President. The amendment adopted by the Committee on Health and Human Resources made a number of significant changes to the bill. First, it returns a collaborative agreement to existing law, including the prescriptive authority of advanced practice registered nurses and the requirement of a 5-year collaborative arrangement with a physician. It adds joint rulemaking for the Board of Examiners for registered professional nurses, the Board of Medicine, the Board of Osteopathic Medicine, the Board of Pharmacy for the prescriptive authority of advanced practice registered nurses. It creates a joint advisory council made up of APRNs, physicians, pharmacists, each appointed by the respective boards. They are to advise the Board of Examiners of registered professional nurses on the nature and extent of collaborative agreements, a means to transition APRNs to an independent practice and to better serve underserved areas of the state, and on joint rules are also required to report back to the legislature. The fourth and final change was the amendment grants signatory authority for APRNs to sign death certificates of patients in their care and assigns specified other certificates such as sports physical forms, advanced health directives, excuses from jury duty, etc. I urge adoption.
The clerk has an amendment to the amendment.
Senators Leonhardt and Williams move to amend the amendment.
Senator from the second.
Thank you, Mr. President. I ask unanimous consent to explain the amendment rather than having it read.
Is there objection? Chair hears none. Junior Senator from the second.
Thank you, Mr. President. This amendment to the committee amendment makes substantial changes relating to the collaborative agreements and APRN prescriptive authority. It established required guidelines for collaborative agreements, including that it must be entered into with a physician licensed in good standing. It allows for APRNs to obtain the authority to prescribe limited prescription drugs without having to be a collaborative agreement if the APRN has practiced at least 3 years with a granted prescriptive authority and a collaborative relationship with a physician. An APRN must apply to the Board of Nursing in order to obtain prescriptive authority without a collaborative agreement. The amendment would limit APRN prescriptive authority to Schedule III drugs with a 30-day supply without refills. APRNs could not prescribe any Schedule II drugs. The Board of Nursing retains jurisdiction over APRNs and the granting of prescriptive authority. The amendment does create a joint advisory council on limited prescriptive authority, which is composed of 4 physicians, 6 APRNs, 1 pharmacist, 1 consumer representative, and 1 representative from a school of public health. The council is given numerous duties, including review and evaluation of APRN applications for prescriptive authority, review and advising on complaints against APRNs, development of pilot projects, and development of studies relating to APRNs. Lastly, APRNs are granted signature authority on numerous healthcare-related documents which are within their scope of practice. I'll be glad to answer any questions and reserve the right to close.
Is there discussion? Is there discussion? Senator from Taylor.
Thank you, Mr. President. I rise in support of the amendment as described by the Senator from Monongalia. It's critically important that we modernize the current health care rules in our state that may delay the care of to patients, especially in our rural communities and underserved areas. West Virginia's aging population and a changing U.S. healthcare system continues to present significant challenges to the healthcare demands of the state. These demands lead us to modernize our healthcare delivery model and utilize highly trained group of advanced practice registered nurses we have available. 21 other states and the District of Columbia have been proactive in planning strategically for this new demand by eliminating the regulation of overregulation of ARPNs. Iowa has allowed full practice for APRNs for 33 years. Alaska 28 years. New Mexico 20 years. No state has repealed the full scope of practice authority once it was enacted for safety concerns. I represent a rural district, as many of you in this body do, and I'm concerned about access to care. If citizens can enter the health care system as at the nurse practitioner level, that will provide them with the access to care all along the health care continuum. By adding more regulatory barriers to the APRNs and nurse practitioners, Many healthcare professionals in counties in my district that border Maryland, a full practice state, may look to leave the state of West Virginia in order to practice the full extent of their education and training. One was just telling me this week about barriers placed in West Virginia which did not occur in Maryland. Last year, there were 10 healthcare providers, either physicians, physician's assistants, or nurse practitioners in Tucker County. 6 of those were APRNs. If we lose even one provider in that county, the coverage gap will grow even wider. In Preston County, 2 APRNs have left the county in recent years and are now practicing full-time somewhere else. I believe without this amendment, we'll see even more healthcare providers leaving the area. West Virginia Rural Health Association suggests areas that were both an aging population and aging healthcare workforce, it is critical to plan for the future for our healthcare delivery. The Huntington Herald-Dispatch had an editorial March 2nd of this year, and in part they said, it is a change that we should provide more access to care in rural areas, where the state has fewer doctors and patients face longer waits and longer drives for treatment. Arizona is one of those states that expanded the role of nurse practitioners a number of years ago, and studies there show the change increased access to health care in rural areas by 70%. We need to be proactive and take action that now addresses the critical shortfall among our healthcare workforce and utilize our skilled nursing professionals that can help to provide all West Virginians access to high-quality primary service that they want and deserve. Mr. President, I urge the adoption of the amendment.
Is there further discussion? Senator from Marshall.
Thank you, Mr. President. With the junior senator from the second yield.
Senator Yields.
Yes.
Thank you, Senator. You know, it's been indicated and represented that there have been some ongoing discussions, but there have been some, I understand, some ongoing discussions between the APRNs and members of the medical community to try to reach a compromise of their respective positions. Is it your understanding that this amendment is presented now before the body is an embodiment of that agreed upon compromise?
Yes, Senator, I do believe that. I think there's been a lot of extension negotiations and discussions, and all parties have agreed.
Thank you.
Further
Thank you,
discussion.
Mr. President. I too rise in support of the amendment, and I can tell you that it's been an issue that has been considered for the last several years down here. I think listening to the comments of the senator from Taylor, I would echo those that there are, in fact, and has been a shortage of access to health care in many regions of the state. I can tell you, particularly in New Martinsville, Wetzel County area of my district, there have been a complete absence of ability to serve many of the rural communities of this state. So I recognize the professionalism of these medical providers and believe that they are going to be practicing within the scope of their practice, and West Virginia will be better served by having more access to health care by trained professionals in our communities. Thank you, Mr. President.
Further discussion. Yep. Junior Senator from the 17th.
Thank you, Mr. President. I rise in support of the bill. Nobody pass out. There has been a lot of debate in the past 24, 48 hours on this, and I think it's somewhat ironic because I've said for years in the hospital system, I have fought for APRN's rights amongst the medical boards of the hospital systems. So, but I've somewhat gotten the reputation of being against ARPNs. There's nothing further from the truth. I've said many times that I think that it is absolutely a integral part of the healthcare system, and the only way we're going to provide care is by getting APRNs along with physician assistants involved. They're highly skilled individuals. I've got some concerns. You know, I think you, Mr. President, said that a good compromise means both parties come away a little bit bruised and not completely happy. I think the bill could have been a little stronger for both sides. But we have come to an agreement, and it's one that I think will work. I think there's oversight. I think some issues that I have with training differences, accountability, with variances among the different training methods of the profession. And again, this has absolutely nothing to do with individuals, has absolutely everything to do with the amount of clinical experience. A disease cares not what the initials are behind your name, but cares if the person taking care of you can identify that and properly treat it. And I think there's high potential for a lot of APRNs to go out there, and I hope 100%. If there are gaps, I think this bill will catch those, and not in a punitive fashion, but in ways to better train and make sure those individuals are capable of providing the quality care that those in West Virginia need. I've heard a lot, senators from Taylor and Mon talk about the improvement of rural care, and I certainly hope that that comes to fruition, and for those reasons, I stand in support of the bill.
Senator from Boone.
Thank you, Mr. President. I also rise in support of the amendment and thus the bill. And we have been afforded a lot of, the bill has been debated, and through the what I would call artful compromise, have come to a bill that I think will help strengthen the entire health care delivery system in West Virginia. Just again, so you know, I mean, the unified message was provide care to underserved populations. And I serve an underserved population. We have a tremendous federally qualified health system and rural health clinic system in West Virginia that incorporates physician assistants, APRNs, and primary care physicians. I had hoped for a mandate that they would go, in fact, into underserved areas. Could not get that in there. There's no requirement or even suggestion that they go into underserved areas, but I think they will. I think they will. There's a bright light being shown here, and with the APRN Advisory Council that has 4 physicians on it, there's no Schedule II drugs. There is a biennial report to let us know where people are going and who they're seeing and how well they're doing. They have more continuing medical education requirements than I once thought. And for that reason, I think it's a time to, like I told my secretary, I said, I don't feel real good about this. And I think the APRNs don't feel real good about this. I think they may feel a little better than I do. But that being said, I urge adoption of the amendment and passage of the bill.
The senior senator from 15th is recognized for about 15 seconds.
Thank you, Mr. President. I promised to keep us within 30 seconds and that's what I promised him. I'm wasting some of them now. When I first come to this chamber, I was ill, and I didn't realize it. And there was an APRN and 2 doctors that actually saved my life. And I cannot tell you, everybody in this chamber, Mr. President, how proud I am that where we're at here today. And the senator from Boone was there for me, my APRN back home, and former Senator Doc Foster, and it makes me feel good. I hope this whole board lights up green and we can go home with a big smile on our face for the people of West Virginia, because I think everybody won here today. Thank you.
Question is on the adoption of the amendment to the amendment offered by the junior senator from the 2nd. All those in favor will say aye. Those opposed, no. The ayes have it. I declare the amendment adopted. Now the question is on the amendment as amended by the Committee on Health. All those in favor will say aye. Opposed, no. The ayes have it. Declare the amendment adopted. Are there further amendments to the bill?
No, sir.
Clerk will read the bill a third time.
Engrossed House Bill 4334, third reading of the bill.
Questions on passage of the bill? The senator from Ohio.
Thank you, Mr. President. I think we've heard the explanation by the senator from the 2nd. I won't belabor the point, just urge passage.
Well done. Questions on passage of the bill? Is there discussion? If not, the question for the Senate, shall the bill pass? All those in favor vote yea. Those opposed vote nay. The clerk prepare the machine. Has every member voted? If so, the clerk close the machine and ascertain the results. On this question, 34 yeas, 0 nays, 0 absent, not voting. More than the majority of those present voting having voted in the affirmative, declare the bill passed. The clerk has the title amendment.
Senator Leonhardt moved to amend the title of the bill.
Questions on adoption of the title amendment? All those in favor will say aye. Opposed? Senator from Ohio.
Thank you, Mr. President. I ask unanimous consent to withdraw the title amendment from the Committee on Health and Human Resources.
Is there objection? Chair hears none. So ordered.
Now the Senator Leonhardt moves to amend the title.
Questions on the adoption of the title amendment? All those in favor will say aye. Opposed say no. The ayes have declared the title amendment adopted. The